During my interview day, I really felt like I was going to be really welcomed into the head and neck family here. One of the reasons that I chose this fellowship was I just felt that the mentorship was going to be so strong, and it has fulfilled that in every way that I could imagine.
I love it here. I think the number one reason to come to university hospitals is the people. There are absolutely incredible people within our head and neck team, and I would challenge anyone that they have a better department than we do.
Our goals are truly to be fellow-focused. There's nothing they wouldn't have seen when they get out into practice, because they will have seen it during fellowship such that it helps them take care of their patients when they're out on their own.
You get to be working with all of our cancer and reconstructive surgeons. That's time in clinic, that's time in the operating room. You'll get time at our multitude of different tumor boards. You want as much experience that you can cram into that 1 year as possible.
So the free flap reconstructive volume here is quite high, about 160 to 180 free flaps a year for a single fellow. There's really no restriction on what you do. You don't have to be with the most senior person. You don't have to be doing the flap. You can do whatever it is that you feel like you need for your education or your future job, and there's really no pressure.
We really care for our patients, and it shows, and I think that our fellows see that. And so our fellows get to see how a world-class program can take care of patients so well and then bring that to whatever job or institution they move on to from here.
Any discussion that I want to have with any of the faculty here, they're just so open to talk about it, to guide me. I just feel incredibly supported during the year.
It's a fellow's disposal what they'd like to pursue while they're here. And that can be anywhere from translational research to benchtop to clinical papers. We really cater to what the fellow's level of interest is.
It's all about you learning what you need to do in your fellowship for your career, and they really support that.
Here at University Hospitals, we say to heal, to teach, and to discover. And that's what I've really come to embrace. That's really what I've built my whole career around. When I began taking care of head and neck cancer patients, they really appreciated the care that you provided them. I had found my people, like all of a sudden, and I enjoy that every single day. There's just something really special about that, and that makes me want to come to work every day.
I feel incredibly supported at work. You know, it's never like, oh man, another day, I'm super stressed, I just want to get home. I really genuinely enjoy being at work and working with these folks here. And I think that makes for a better training environment. You know, when you feel that comfortable with everything else, you really feel like you can just focus on the surgery and the patients. You're just going to become the best version of the surgeon that you can be.
The mission of the hospital is to be as patient-focused as possible. You understand that it's a commitment to patient care, commitment to the next generation of fellows and residents, but also to the research mission and to our academic mission.
Where can we fill in the gaps? What do we need to be doing that can further our offerings to patients? And this, I think, is really important because we need to be identifying what's out there, what can we bring in, and how can we be better serving our patients.
What I want the graduates to take away from is that they've had an excellent year. At the end, they're going to look back and say, wow, I feel comfortable going out and managing head and neck cancer patients, and that they know that they're going to have a family here that's going to support them. Relationship's not going to end on graduation. It's actually going to be just a new beginning because we'll help support them in any way possible moving forward.